As usual, put up with a lot, worked hard, did an amazing job. I think everybody here loves you both, and I think we felt like you did, again, went out of your way.
They come in excited, bright-eyed, bushy-tailed, but they're absolutely broken down, and they're made to realize that how many things they don't know and what they do wrong. But it's not because we don't like them, it's because that's what you are going to demand when somebody is going to take your own pet to surgery, or your mom, or your kid. When Guardian establishes these types of levels of stringent, ridiculous benchmarks that we want, guys like Josh and Tasha make them. It makes me proud, it makes Rob proud. And that's all of us, it's our legacy. When they go out to other hospitals, they're gonna be, I was at Guardian like we are, and they're gonna represent us, they're ambassadors for us. And I know they're gonna become board certified surgeons because they have what it takes and they proved it. And with the right kind of time, as they're doing, it's gonna happen. So I hope everyone here understands that what they went through is something very special and it's hard, and I'm proud of them. So is Rob, and Rob can't be here to say this, but he agrees with me. And they will always be our mentees, and one day they're gonna be our surgical colleagues. I'm looking forward to that.
Go, go, go.
Oh, who doesn't want a treat? Yes, it does. No,
So this little guy unfortunately had a rough encounter with a baby porcupine, and he got a face full of quills. So the important thing to know is that it's very painful when they come out. So you don't want to start pulling them out at home. You want to bring them in to see your veterinarian, and the veterinarian will essentially anesthetize them so that we can start taking them out one by one.
Oh, the baby. Is she gonna kiss it? What's your baby? Do you want that test?
They are
Look at baby. I know, it's so cute.
wow,
baby.
so enthusiastic.
They are. Look at his little paws. Her little paws.
What?
Her little paws.
Bella is a 2-month-old female intact French Bulldog who's presenting today because of concerns of her not being able to hear. French Bulldogs are one of the breeds of dogs that we do see that can have some congenital deafness. Other dogs we see with it pretty frequently are Dalmatians. You guys did an Australian
Aussies.
Shepherd a while ago, and
Bull terriers.
yeah, bull terriers. But cats, white cats with blue eyes, can also be predisposed to deafness, and so we can do a test that's called a BAER, or brainstem auditory evoked response test, where we basically put some like electrodes to record and see if they are actually hearing or not. So it's one of the most common electrodiagnostics we do in veterinary neurology.
They're getting it riled up. Ooh, ooh.
Yeah, we don't want them riled up.
It's neurologically normal. I know you're shocked.
Shocking. Oh, you're adorable.
Where's the corn?
So normally there'd be like
8 waves, but like 5 big ones.
a couple waves that are really distinct. If it's like nice and flattish like this, that's showing that there's no repeatable signal.
So this is what kind of a normal BAER test should look like. So you see all these waves, which we did not have in Bella's case. So all the different waveforms that correspond to different parts of the hearing pathway. And in hers, she kind of flatlined in both of them, meaning that there's no discernible waveforms, meaning that she does not hear in either ear.
Get it. Get it. You want to fight it?
So this dog has a mast cell tumor here, and actually has another suspected benign glandular growth on the other side as well. But this mast cell tumor, we're gonna go around about 1 centimeter around the tumor so that we can try to get clean margins. And then once we remove it with the laser, then we're gonna go through the leftover tissue with the laser to try to clear up any sort of residual potential tumor cells. Now this one is, we're not going huge margins because we do suspect this to be a low-grade mast cell tumor. If this was more of a high-grade, then we'll go to surgery for a larger excisional area.
They don't know if it was. They said it was. They did an ultrasound and there was intestinal